Hi, good evening. I'm Senator David Carlucci. Want to thank everyone for joining me here tonight. This is another edition of our virtual town hall. Now that we're all practicing social distancing, it's a good way for us to communicate, to take questions, and to keep you up to date with what's happening. And tonight we're about to start Passover. I'll be celebrating and having a Seder with my family here at my house in New City. And like so many of us, I know there's traditions that are being broken, long-standing traditions, and hopefully many of us can communicate via Skype or Facebook Live or instant whatever it is. But it's we know that the social distancing is starting to show some positive results. So now is the time to make sure that we stand strong and we continue that discipline of staying home and staying safe. And with Easter upon us as well, we have to make sure that we're all conscious of the fact that we have a crisis going on. And the best thing that we can do is to keep ourselves safe, and meaning that we will not be a burden to our overrun healthcare system. Right now, we know that we have approximately 150,000 positive cases of COVID-19 in New York State. We have approximately 6,500 positive cases in Rockland County and around 16,000 positive cases in Westchester County. And the most unfortunate number, and a number that keeps going up, 6,268 deaths reported as of today, April 8th. So this is just really sad, and I think we all know someone that has probably been lost. Phil Tisi, who worked for the town of Ramapo for so many years. Unfortunately, he passed away yesterday, so my thoughts and prayers are with his family. We also learned today about Richard Brodsky, a former assemblyman who represented Westchester County, someone who I got to know well and was really just such an intelligent person that always spoke his mind, often went against the grain, but really for the good of all of us, our community and our state. So he will be greatly missed as well. So many others that it's just so hard and so shocking to hear these numbers, but it reminds us of how serious of an issue this is. So I want to assure everyone that even though my district office is physically closed, it remains open to all of you virtually. Our phone lines are open. Our emails we're looking at constantly. My website at senatorcarlucci.com is for you to use as a resource. But please call me anytime at 845-623-3627. Again, that's 845-623-3627, as well as my email, which is carlucci at nysenate.gov. That's carlucci at nysenate.gov. Please do not hesitate to reach out to me. Myself and my team are working constantly to make sure that we're answering your call, answering your question and your problem. And it's very important that I hear from you and know exactly what's going on. So with that as well, I want to remind everyone that we are doing a text messaging program as well. So you can stay up to date via text message. And to sign up, it's very easy. Just text the word Carlucci and to the phone number 797979. So you would use the keyword Carlucci and text it to the number 797979, and that will enroll you in our text messaging program to keep you up to date with what's happening. You know, yesterday I had a conference call I did with our student advisory committee, and we had students from all over the Hudson Valley update me on what's going on and how remote learning is working. And they have been fantastic, and we've always met in person. So this was the first time we did a conference call or a virtual meeting, and it really worked out well. And we're planning to continue to do that. Last week, I did a town hall with our senior advisory committee, and that worked out very well. And tomorrow, we have our veterans advisory committee, and we'll be meeting at 1 o'clock. And if anybody is interested in signing up for my Veterans Advisory Committee, please call my office, let us know, and we'd love to have you in that meeting or any of the meetings that we're doing, whether it's our Senior Advisory Committee or our Student Advisory Committee or our Veteran Advisory Committee, working together, listening to the problems on the ground. Our philosophy is we talk about the problems, but then we focus on the solutions. And because of that, we've been successful. Last year, I was able to pass more legislation, get it onto the governor's desk than any other lawmaker in the state of New York. And that's because we've been working together. You've been updating me, letting me know the problems, and then we're focusing on how we can make a difference. So tonight, we're very fortunate that we have a very special guest, Dr. Steven Ferrara. And Dr. Ferrara is a practicing nurse practitioner, and he's also an associate dean and associate professor at the Columbia School of Nursing, and he is the executive director of the New York State Nurse Practitioners Association. So we're very fortunate to have Dr. Ferrara join us tonight. I know he's extremely busy at this time, and all of our healthcare professionals are. So we're just so grateful to the work that our nurse practitioners are doing and all of our medical professionals and support team. We just want to thank you. And Dr. Steven Ferrara, thank you for being with us tonight. And thank you for joining us. I know this time is extremely busy. So to really start it off, Dr. Ferrara, I mean, you could tell us a little bit about what the Nurse Practitioners Association does. And then I know I have a bunch of questions for you, and I'm just so glad you're joining me here tonight. So maybe you could just introduce yourself and tell our viewers a little bit about yourself and the work that you've been focused on most recently.
Sure. And thank you, Senator, for having me. Really grateful to be here and to talk about, from my perspective. So I will introduce myself as I am a family nurse practitioner, and I've been a nurse practitioner for 20 years. And I'm currently wear two hats. One is as the executive director of the Nurse Practitioner Association, New York State, which is the statewide association for nurse practitioners. And we advocate for nurse practitioners across the state. We want to make sure that there are as few barriers to practice for nurse practitioners in New York State so that we can take care of the patients that choose to see us for their care. At Columbia University School of Nursing, I oversee our nurse practitioner faculty practice. So this is a primary care practice with about 12 nurse practitioners who are caring for patients every day here in northern Manhattan. And we've converted our clinic right now to more of a cold, cough, and fever clinic. I can get into that a little bit more, but we are responding to the COVID crisis and trying to have a meaningful response to anything we put forward so we could sort of take the strain off of the emergency rooms, which is where hospital systems are getting hit hard.
Yeah, no, it's just, it's really wild. And that's what we really wanted to hear, really what you're seeing, what you're hearing, particularly from the Association of Nurse Practitioners. We know that the governor has instituted the Surge and Flex program, and really to be in constant communication with our hospitals and making sure that the need, the resources are going to where the need is. What do you think about that? Have you seen what's happening with that policy and how you think it's playing out?
Yeah, absolutely. There are many administrative burdens to clinical practice, and all of us in the health professions sort of struggle with that at times. But the actions that the governor has taken has really taken off those artificial restraints and have allowed us to take care of the patients that we need to take care of, where and when we need to take care of them. So, we're still getting up to speed. We're still trying to redeploy resources to where they're most needed. But certainly these are very important tactics that have been taken so that we could care for the patients in most need.
And what are you seeing? I mean, what we've been dealing with, I've gotten calls, I've gotten the text messages. We get a lot of questions about the PPE, the personal protective equipment, and the need to make sure that our nurse practitioners, all of our medical professionals, everyone there is having the appropriate protective equipment. What have you seen? How are we doing on that on the front lines?
Yeah, I think it has gotten better in this week, but we still have a number of issues to go. I think what folks don't necessarily always realize that when we don PPE and get ready to see a patient, that's a one-time use. And then we have to take it off and start over again for our next patient. So, all the numbers sound mind-boggling. There's a million N95 masks, or there's, so many gloves, but those are single use. And that's what infection control and infection prevention is all about, making sure that we as healthcare providers are not transmitting infections amongst our patients and amongst ourselves.
Yeah, no, absolutely. Yeah, it's something that we've been trying to make sure that the National Defense Procurement Act, that it's in effect, that we can have this strategy, and the governor keeps talking about it, which makes a lot of sense, because when we talk about New York, we're this rolling apex that we're going to see, that it's going to hit us first, like it is now, whether you're in New York City or the Hudson Valley or Long Island, and now it's spreading throughout the state, throughout the region. And that's why we have to be coordinated, that the supply is going to really where the demand is needed. One of the things that we've seen now, that the issue with ventilators, that this desperate need for more of them. We know that some were sent to Rockland County and Westchester County and New York City and Long Island yesterday. About 38 came to Rockland. But one of the things that we've seen is this idea about splitting the ventilators, and also about the altering the BPAP machines. And, this is something I have no familiarity with. I'm just learning as we're going. But maybe you could speak a little bit about that. Is that something that could work, is working, what some of the problems might be?
Absolutely. So, and acute care and critical care is not my primary area, but I'm working alongside folks who are in those areas. So, as far as splitting the ventilators, yes, you can't do that with every ventilator. It has to be matched up to the right patients. So two patients need to be sort of matched up to share that one ventilator, and it can't be done widespread. It has to be used in judicious usage going forward. So that is definitely an option. And I know for certain that here at Columbia University and New York Presbyterian Hospital, we have a number of patients who have been on split ventilators, and it's been working well because we've needed to make it work. So it's working. As far as the BiPAP machines, those are not ventilators. So they can assist with breathing, but it's not a long-term solution for someone who cannot breathe on their own. So it's working. It's working, again, because we're moving supplies in and making sure that we have a influx of units of ventilators. But these are all stopgap measures as we speak of them. I mean, the ideal situation is a patient who cannot breathe on their own has their own ventilator. But I think what we've seen through this is innovation, and we've seen real ingenuity and learning from the world and what has happened in China, and have some consultants work with us on that to make sure we can properly put that in place here.
Now, when you talk about the BiPAP machines, that's a manual device? Is that what we're talking about?
No,
Like
the BiPAPs are actually no. That would be called a manual mechanical ventilation. BiPAPs actually has a force of air that will come with generated through the machine. There are the other mechanical, and I've seen a number of solutions for that where there's actually something that will pump the bag so somebody doesn't have to do it on their own. So that is worst case scenario, where there are no machines, you can't split a ventilator, you can't use a BiPAP, but you're really just relying on manual mechanical ventilation at that point.
One of the things I wanted to ask you, being that your work at Columbia School of Nursing and the need for healthcare workers, and I've always been amazed. We have some great nursing programs right in Rockland and Westchester counties. I've been fortunate to be at some of the pinning ceremonies, And I have an idea of how difficult it is. This work is first to be just a registered nurse and then go on to get your degree to be a nurse practitioner. It's not for the faint at heart. The governor has recently put out an initiative to allow for nursing students and other medical students to be able to really graduate early, in a sense, and to be able to practice medicine in an expedited fashion. What does that really mean? And from your background of being a dean and a professor at Columbia, what do you think about that?
Well, I think it's necessary to get the necessary person power to operate those ventilators and to make sure that we can care for those patients on the front lines. We also want to, look at it from a global perspective and say, we don't want to put somebody in a position that they're not adequately prepared or educated to do. But we do know in the latter months of leading up to graduation, really most of the bulk of the work has been done. But these are still new clinicians, and there's got to be a learning curve with them. So it's not a perfect solution, but it is one to sort of solve the need of not having the necessary people, healthcare personnel to take care of the patients that need taken care of at that point in time. So I think it helps. It is not an end all be all, and we want to make sure that they're safe. That they are brand new clinicians. We don't want them to try and think they're going to save the world because there's a mental health perspective that all of us clinicians are facing right now, and the mental strain, not just at work but with our families, and we all are as a society today. So we can't forget about that because that's something very real that we all have to keep in mind.
Absolutely. Another question that I have for you is, and something that we're talking about a lot, is increasing access to telemedicine. And I wonder, from your background, especially as being a professor and wearing so many different hats in the healthcare system, what are we capable of doing right now, and where do we need to go when we talk about telemedicine?
Yeah, that's a great question. And I think we have gotten really good at telemedicine in a very short amount of time. Prior to this COVID pandemic, we sort of had very limited use of telehealth, and it had to be the right patient, it had to be the right condition. Well, all that has been sort of thrown out the window at this point, because we don't want well patients coming into the office sitting alongside patients who are ill. So we've learned very quickly to be able to harness the power of telehealth, telemedicine. You mentioned doing your meetings virtually. Well, we are doing that in healthcare right now, and we help patients elicit information for us that because obviously we can't touch and examine the patient. But there's methods that we can guide the patient how to take their own pulse and put their hand over their chest to count respirations. So these are things that are helping us to be able to conduct a virtual exam. I think what we will see going forward is the development of devices that will assist in the examination, where it's hooked up to the cloud and you could actually put it over your heart and it will record your heartbeat. So there are some of these devices that are out there now. I think we're going to see broader adoption and use of it. And part of the challenge with telehealth has been state lines. And, as a nurse practitioner licensed in New York State, I am only allowed to treat patients in New York State. Now these rules have been relaxed interstate-wise, but we live tri-state area. There's people who live New Jersey and Connecticut that are close by, that they may be calling in from home. They may see you. They may work in New York but live elsewhere. So right now these rules have been relaxed, but we're going to have to look at this in a meaningful way post coronavirus. And figure out how do we maintain continuity of care with patients, clinicians.
Yeah, Dr. Ferrara, it really sounds like we need to be better patients, and we have to now be able to work with our doctors, our nurse practitioners over the phone, with the telemedicine. And you mentioned a little bit about it in terms of devices that might help. What would be some simple advice you would have to all of us, us laymen's, about how to be a good patient?
One of the most important aspects of patient care is what we would call patient history. It's those questions we ask you, they're important. So when we ask a patient, hi, how,
This is
you
Dr.
know,
Ferrara.
With my mask.
I'll talk to you. I'll talk to you in a little bit.
so,
James is very excited because we were making homemade masks and we were learning how to do that. And now he's demanding that I make special masks so he'll look like a ninja. So
that's
he
great.
can't wait.
That's
So
great.
I promised him when we
Yes.
got off the phone. So sorry to interrupt. Thank you, Dr. Ferrara.
Well,
Please continue.
making masks sounds a lot more fun than listening to me. So,
No, I think
but
this is really great.
so what patients? It's really important to document the signs and symptoms you're having, and when you are speaking with your healthcare provider, to accurately reflect those. So when you say I have pain in my knee, it's really important to know, is that pain constant, or has it been there for a week? Does it come and go? And these are the types of things that me seeing a patient in a telehealth visit is going to help me make that diagnosis, because the more information I have, the better that we can formulate a plan together.
Is there any personal equipment that you would recommend that we try to order on Amazon or something like that, like a special thermometer or a pulsator or something like that?
Yeah, I wouldn't say go out and get one right now. I know that it's supplies are far and few in between. But having a home automatic blood pressure cuff would be great. We've always thought, there's a thing that we diagnose as white coat hypertension. And that is when you get high blood pressure walking into the office because it's an unnatural environment. And you're worried about, am I going to get a vaccine, or am I going to get, blood work drawn today? So that artificially elevates one's blood pressure. It would be fantastic for us to know when you're home in your backyard on your deck what your true blood pressure is. So automatic blood pressure cuff would be one thing. I like the temporal thermometers. They are a bit more expensive, but you don't need to spend that money. A regular oral thermometer will certainly suffice. And the pulse oximeters, you mentioned that. This would be helpful if somebody is ill right now, because it will help to know the percentage of oxygenation that is in your blood. It uses an infrared sensor for that. Now, I will also say people like to walk around with them, and when you walk around and you're sick with a lung infection, those numbers are going to drop. So don't get so caught up in the numbers. What we want to know is, what is your oxygenation level at rest? And that would be very, very helpful for us. So we're not bringing sick patients back in. We're actually monitoring patients to make sure that we don't want them to return to the emergency room if they don't have to. So we've implemented some extensive telehealth follow-up visits of patients who have been discharged, so they don't find themselves calling 911 because they feel a little short of breath. Now, I will say, if you feel short of breath, contact your healthcare provider. But breathing is really important. We don't want to have anybody short of breath, and being in touch with your healthcare provider is going to be definitely the best thing to do.
Yeah, I'm just fascinated and trying to stay on top of it as much as possible. You talked about how it's really forcing us to innovate, and I feel like the healthcare profession, there's no question about it. You have absolutely been forced to make changes and do everything you can because you're on the front lines of this war. And I've been thinking, just from the point of views of every profession and every aspect of society is really being changed at a drastic fashion. I mean, one of the things that we're doing now in the state Senate, for the first time in its over 200-year history, we now have the ability to vote remotely. for the period of this crisis. So it's a very interesting thing, and it's showing how we're all being forced to use this technology, and it's just very interesting to see what will happen. One of the things that we have coming right out of the state of New York and the New York State Department of Health is they've really been innovating on ways to do rapid testing. And we hear from the highest ups, from the CDC to the Department of Health with Mr. Zucker, Dr. Zucker, that they're talking about rapid testing really will be the way that we'll be able to have more confidence over this disease in the future. Do you have any insight in that, in what you think what we should be looking for, and what will really be the importance of rapid testing, and why that will be very important for overall for public health?
Yeah, absolutely. And it's critically important to have testing. We report every day on the numbers, and the numbers are only telling us those patients who have actually been tested. And not, unfortunately, everybody's not being tested that could or should be at this point. From what I understand, certain hospital systems are actually implementing some point of care testing in very limited numbers. FDA has cleared these devices, but they're still not available as broadly as they could or should be. But we're working with it, right? We're working with what we have, but testing is critical so we know where we are. And that's, we've been sort of behind this from the get-go.
Dr. Ferrara, one of the disturbing numbers that are coming out of the governor's reports, and something that we've been seeing, is this the racial discrepancy between the people that are suffering the most, the death rates. We now see that communities of color are experiencing a higher rate of death, and that's very troubling. Could you speak to that, some of the things that you think are going on here, and ways that we can fight this head on?
Yeah, and this is something very important to me in healthcare, is there are health disparities that exist, and it is unfortunate that the healthcare system doesn't necessarily treat everybody as equals. So we're not necessarily seeing patients of color being more affected because there's something physiologically wrong, but it's the comorbidities that some individuals have. So the fact of obesity and diabetes and hypertension, because these issues are unchecked, it's making folks much more susceptible to this pandemic of coronavirus and these COVID symptoms. I want us to use this as a platform to go forward and say we will address health disparities in care today. And I think the governor has rightly so, and actually Dr. Fauci as well from the podium yesterday are making these statements, and they need to be heard. They need to be addressed.
Yeah, it's so true, and I think it's the calls that I get in my office. It's something that we see all the time, that people that don't have access to health insurance, don't have access to telemedicine because they don't have the internet or a device to use. And that's really, and also people on the economic spectrum where they're working jobs where they can't call in sick. And that's a real serious issue. And we need to highlight that and make sure that everybody understands the discrepancy that's going on, and that we have to really fight to make a difference there. One of the things I wanted to make sure to ask you is about how I serve as the chairman of the Mental Health and Developmental Disabilities Committee, and we know that it's the workforce, whether it's mental health or developmental disabilities, that's really the backbone of the system. And there's no question about it. I think everyone is recognizing right now how the equipment is important, but it does very little if you don't have the people power behind it, if you don't have the workforce and the trained professionals. So that's really everything. And what I wanted to hear from you is really what your ideas are in terms of how do we, I know we're in an urgent and we are in a crisis circumstance right now. So we're doing everything we can to get medical professionals to the front lines. We talked about having people even graduate early and be able to practice as soon as possible. what do we do long term? What do we do long term to really attract the best people into healthcare and also allow them to be able to afford it and live in what we just talked about? In sometimes there's underrepresented communities, whether it's inner city or rural. What do we do to encourage the best to go into healthcare and encourage them to practice in areas where it's most needed? And I'm not talking necessarily about what we do this second to meet the crisis, but I think it really emphasizes that the healthcare system is only as strong as its weakest link. And if we don't have a pool of people wanting to do this and to step up and to be able to practice medicine in those places, it'll be a serious problem for some time to come.
Absolutely. And what I think is the benefit of if there could be a benefit of this crisis, of the silver lining, is we are highlighting the work of healthcare personnel, of frontline workers, emergency responders. We're highlighting the work of the people at our grocery stores and everywhere else. I think this will help to attract new people into the profession. But we can't just have new people into the profession without making sure that we're protecting them once they get here. And that is, points to the PPE or the lack thereof that has been an issue. So we want to make sure that people can competently practice, can safely practice. One of the first things that we always think about when we take care of patients is first, do no harm. So we want to make sure that everything we possibly do is keeping the patient safe, keeping us safe. And we need a pipeline. We need to encourage people who are interested in healthcare. We are seeing that there are many positions outside of medicine or even nursing. Respiratory therapists have become one of the most in demand professions right now because they are the ones who are experts at working the ventilators and making sure that the patients are being appropriately titrated so they're getting the right amount of oxygen and breathing when it comes, and working in tandem as a team. So there are a lot of silos in healthcare, and I'm hoping and I'm seeing that these silos are being broken down right now because they have to be. So for us, in order to take care of these patients, we can't worry about, appropriately asking this person for permission. We just have to do it. So I'm hopeful that this will start, eliminating those arbitrary barriers, making sure we get an influx of passionate, intelligent people into the profession and compassionate.
Well, Dr. Ferrara, you've been so generous with your time tonight. I really appreciate you joining us. I know I could probably keep you all night, and we even got many questions on Facebook Live that I really couldn't get to. Some of them are very technical, and maybe you'll have the time to go through and look at these because it sounds like some of your former students asking some real technical questions or other medical professionals. So it's very good, and maybe we can respond online with them. But I wanted to thank you for your time, and I want to thank all of our healthcare professionals, and particularly the nurse practitioners, the Nurse Practitioner Association of New York State. They're serving such an important need always, but now we see it more than ever. And with that, do you have any closing remarks for us? Anything you want to leave us with before we end tonight?
Well, as a nurse practitioner, I would be remiss to say, remember, washing your hands is important. It's one of the best ways to continue to stop the spread. And 20 seconds scrubbing back and forth, sing happy birthday twice to yourself, and that's the right amount of time to wash. And we still need to social distance. We still need to practice isolation in place, precautions. I know that we're getting some good news about hitting the plateau and sort of hopefully we've peaked, but this is not a time for people to go out and sort of think that the threat is over. So I urge people to maintain the course, still be safe, and call your nurse practitioner, call your physician who's there willing to help you if you have any questions about your health.
Well, Dr. Steven Ferrara, thank you so much for joining us tonight. Dr. Ferrara is the Executive Director of the Nurse Practitioners Association in New York State, an organization that keeps us on our toes up in Albany and makes sure that we're doing the right thing for the nurse practitioners, and in doing so, for the entire healthcare system. So thank you for the work that you're doing, and thank you to all of our healthcare professionals. I want to remind everyone that even though my office is physically closed, it remains open to all of you to use as a resource, that if you have a question, a problem, you don't know who to call, please call me. And I want to hear from you so that I know exactly what's going on, because often if you're having a problem, you're not alone, and we can help address the problem you're dealing with, but then we can make sure we're tackling it on a global level. Please visit my website, senatorcarlucci.com. Sign up for our email newsletter. Give me a call at 845-623-3627, or send me an email at carlucci@nysenate.gov. And please join me, whether it's our Veterans Advisory Committee, if you're a veteran, or our Student Advisory Committee, if you're a student, and our Senior Advisory Committee. And please call us, RSVP for that. We're meeting regularly, and we're tackling the issues that are extremely important to all of us. And us working together, we're going to make sure that we not only get through this, we get through it and we're stronger on the other side. So I want to wish everyone a very happy Passover and a very happy Easter, and look forward to seeing everyone really soon. Thank you for joining us tonight.
Thank you, Senator Carlucci.
Thank you so much.
My pleasure.